Overcoming food sensitivities after lap band surgery. After lap band surgery, many patients experience food sensitivities due to changes in their digestive system. These sensitivities can lead to discomfort, bloating, or nausea. Managing these issues effectively is crucial for a smooth recovery and long-term success. Here are some practical tips to help overcome food sensitivities after the procedure. 1. Understand the causes. The lap band surgery reduces the stomach size, which can make it harder to digest certain foods. This can lead to bloating, discomfort, or acid reflux, especially after eating large portions or trigger foods. 2. Identify trigger foods. Certain foods tend to cause more discomfort, such as spicy dishes, high-fat foods, carbonated drinks, and sugary snacks. Keeping a food journal can help pinpoint which foods cause reactions. 3. Start slowly with solids. After surgery, a gradual approach to eating solid foods is recommended. Begin with liquids and pureed foods, then slowly progress to soft foods, and finally solid foods. This approach allows the stomach to adjust and heal. 4. Portion control. After surgery, your stomach can only hold small amounts of food. Eating small meals and avoiding overeating helps prevent discomfort. Take your time while eating, chew food thoroughly, and eat slowly to help digestion. 5. Focus on easily digestible foods. Choose soft proteins, such as fish, eggs, and poultry, as well as cooked vegetables and low-fat dairy. These are easier on the stomach and provide essential nutrients without irritation. 6. Stay hydrated. Drinking enough water is key to digestive health. Sip water throughout the day and avoid large quantities in one sitting to prevent overwhelming your stomach. 7. Consult your doctor. Regular follow-up appointments with your healthcare provider are essential to monitor your progress and address ongoing sensitivities. They can offer personalized advice on managing your diet. By following these steps, you can minimize food sensitivities and ensure a healthier recovery after lap band surgery. And always consult with your doctor to get the best recommendation. Thanks for watching.